Welcome back. Well, in the wake of Robin Williams' death, it's a good reminder to think about mental health, how you're doing, the warning signs you should be looking out for in yourself and others. And joining us now is Richard Odium from Greater Kansas City Mental Health Coalition. He's here to go over all the questions that we should be thinking about. Thank you for being here. And how is this wake-up call with Robin Williams' death? What should we be thinking about as this is coming to light?
Well, it certainly makes us think about how serious and deadly mental illnesses can be, and how difficult it is to talk about mental illnesses with the shame that goes along with mental illness and the stigma that goes along with mental illness. So what we can do is really understand what mental illness is and how it presents. For example, depression is this pervasive sense of sadness and loss of pleasure and everything, and it can really affect us functionally as well in how we sleep and how we eat. And also affects our idea of ourselves, that we feel unworthy or burdensome. So even when we have people around us that love us, or we may have all the external trappings of success, it still doesn't matter, or somehow we feel unworthy of it, or we don't deserve it.
And that's more than just having a bad day. What are some of the specifics from, having a bad couple of days maybe to actual depression? Yeah,
well, when we think about depression, we're thinking about something that's persistent and pervasive. It's been going on for much more than 10 weeks. It may be out of proportion to what's going on in your external life. We all have ups and downs and have disappointments in our life, but we're talking about a clinical disorder that really robs you of your ability to function properly. You may have difficulty getting out of bed. You may have difficulty showing up at work and concentrating and doing your work. You may have thoughts of wanting to end your life and thoughts of suicide.
And for recognizing those signs in other people, sometimes you hear family members say afterwards, I just never saw the signs. What are some of the signs that other people may show to be on the lookout for?
Well, I think any change in somebody's personality or behavior or functioning kind of prompts that question of, I've noticed that your behavior has changed and I'm concerned about you, or is there something going on that we can talk about? And to give that person reassurance that you're there for them. I'm here with you. You're not alone in this.
Is it better to have that as like an intervention with other people or one-on-one, or what's the best way to approach that?
Well, I think that varies. I think if you have that relationship with that person, that can be very meaningful. If there are other people, other family members or professionals or clergy people that might also be influential or connected with that person or mean something to them, then I would say widen the circle if you can.
And mental health illness, it affects more people than we know.
Yes, it's very common. 1 in 4 of us can be diagnosed with a mental illness in any given year. It's more common than cancer or diabetes or heart disease, for example. So it's very common. And yet we have such difficulty talking about it, and that's the work that we're trying to do through the Greater Kansas City Mental Health Coalition, is create a climate or a context where it's as easy to talk about mental illness as it is about diabetes.
And there's also a website where people can get more information. Just go to itsok.us.